Hello, Megan Thompson here with Megan Thompson Coaching, and we help parents of highly sensitive kids eliminate the daily meltdowns, and parents and teens eliminate the daily shutdowns in as little as 10 to 12 weeks, depending on the program. So, we're here today to talk about Psych Evals. So, the full name is called a psychological evaluation. It's run by a psychologist, administered by a psychologist. And I wanted to get a clear picture for you guys on what this might look like if you're considering this need for your highly sensitive child. Many parents will, along their journey of trying to figure it out, when you're dealing with daily meltdowns, in and out of frustration and aggravation, your kid's hitting and their sentences don't make sense when they're in that meltdown. They're saying things that contradict themselves and they're frustrated and they're stuck, and so are you. You can move into trying to figure out how your child's brain works, right? How are they thinking? They're not thinking straight when they're in meltdowns. And while that's true, that is absolutely true, the cause of that for highly sensitive kids is much different than children who fit the criteria for a mental health disorder. So I want to speak about this today, being a licensed clinical professional counselor myself, and being able to give you the understanding of the difference. Now, we won't go through all of the myriad of diagnoses, mental health diagnoses that your kid could be diagnosed with if they're highly sensitive and they're misdiagnosed. That's for a different day. We have another training video for you on that. But today what we're going to talk about is part of the journey that you might be considering in terms of discerning whether or not a psych eval is relevant for your kid. Now, for those of you who are just getting started and understanding how the mental health industry works, it's important to understand I am not talking about an evaluation by somebody who will prescribe medication. That's a psychiatrist. Psychiatrists prescribe medication. Psychologists administer tests, and some are skilled in providing therapy, but that is a different specialty. Some psychologists just go into research and assessment, psychological assessment provision, and so it's really crucial to understand the difference. A licensed counselor is a therapist. A social worker could be either a therapist or more of a case management role. Think Child Protective Services, Family Services, criminal justice, etc. Though a counselor can serve many of those roles and can also administer some tests depending on their training. But a psychologist would write a psych eval. And so if a school is recommending that, then the school psychologist would take care of that. Or if your child, we'll speak about this, is if it's recommended that your child receive that privately, then you would seek an outside provider, private practitioner who's a psychologist who would administer psychological evaluation and the assessments associated with that. The psychological evaluation is the stack of papers, the combination of all of the assessment data, and the analysis of that data is what is in the evaluation that you will receive. You might receive some raw data, some numbers and scales related to some of the evaluations, but the full raw data is typically kept private by the psychologist for professional interpretation, and then the interpretation is what's written up into the many pieces of paper you'll receive from that professional. And depending on their skill set, as well as their professionalism, they will review it with you, or they will briefly read it. And that's important to understand, because we have lots of parents who are going down this journey wondering how their child's brain works. And if your child fits the criteria for highly sensitive personality trait, I want to help you understand the difference between that and a mental health disorder that a psychological evaluation might provide. So let's get some clarity. Okay, many parents can treat the objective of a psych eval like a magic wand, and I want to support you in understanding the difference between the two of those. Okay, because what we want to cover are first a few facts about the highly sensitive trait. Okay, so highly sensitive personality, HSP, highly sensitive person, HSP, highly sensitive child, HSC. All of those acronyms fit into a category in the research that's called sensory processing sensitivity. Now, there's a lot of alphabet soup today, so make sure that you're taking notes to keep it straight. You've already been down Google, you've already looked at, I'm sure read plenty of parenting books on your journey to end the meltdown cycle. And today we're going to try to keep it as simple as possible, though thorough, on where you might be stuck and how to make an effective decision in eliminating the meltdown cycle. So, a couple of facts, okay? Sensory processing sensitivity, SPS for short, is the trait that highly sensitive people have. That's the name of the trait. So, liken this to Elaine Aron's research. She's the one who coined SPS. She named it. She named highly sensitive trait as sensory processing sensitivity. And from there, she wrote a book about it after she published some research, independent research, and single papers and things like that. And then she wrote a book, The Highly Sensitive Person, and has written several books since then. And she published in the 90s when she coined the term. And then it's important to understand that the highly sensitive trait has been around for many, many more years than that. Okay, so I want to cover this more thoroughly. Okay? There are over 100 years of research and clinical writings and studies that concur with the fact that highly sensitive people exist. And it's also true that over 100 different species have been found to have some parts, some beings in the species to be highly sensitive, all the way down to fruit flies. They can identify highly sensitive fruit flies. So, great news, this personality trait is not a fad. You've probably heard of type A personality trait. So if it's been hard for you to, or maybe you're co-parenting in a two-parent household, many of you can understand the fad language of type A, right? He's a very type A person. She's a very type A person. Guess what? HSP can also be along the same lines in the sense that you can notice that many people know about type A, and HSP, because it's only do the math, 30 years that we've been using that language to describe sensory processing sensitivity. Maybe you might not have heard of it, over maybe the last year or so you've been on this journey to figure this out, a couple of months, who knows how long you've been studying or trying to figure out what's going on with your child and why they're having so many meltdowns. But it's crucial to understand that this is not a fad. Highly sensitive people have been identified in our population for over 100 years, starting all the way with Carl Jung, who studied under Sigmund Freud. So, famous psychologist, you must have heard of him in even high school or beyond. And Carl Jung was actually branched off from Sigmund Freud in his study when Sigmund Freud started tying everything to mommy issues and neuroticism. And Carl Jung, who identified as highly sensitive, said, you know what, we're not actually neurotic. This is part of my personality. It's a strength. We're not broken. And it's not due to mommy issues. And I'm obviously tongue-in-cheek naming the Oedipus complex, Oedipal complex, and all of the concerns that you might have related to Sigmund Freud's theory. But what's important to understand is that parenting plays a major part in whether or not highly sensitive people struggle in their life. And so you've heard me say this before, and if you're just catching this is the first time that you're listening, then it's super critical that you make the distinction that having daily meltdowns does not go hand in hand with being highly sensitive. However, if your child is highly sensitive with daily meltdowns, then you want to tune in because your parenting relationship is critical in impacting your child's behavior. Hence what we do here at MTC. So, and why it's so helpful. So when we speak about what this means, I want to break down how the mental health industry has been running in parallel to understanding personality. Okay, so a disorder, a mental health disorder, is a diagnosis for someone whose emotional regulation problems have become pervasive across multiple areas of their life, and it impacts their daily functioning. Now, you can end up with a mental health diagnosis in today's world. Might look like ADHD, might look like, sorry, I'm blanking, generalized anxiety disorder. Lost my word for a minute. Bipolar disorder. And when we think about all of those diagnoses, what they indicate is that there's something malfunctional with your child's brain and body. Now, when we think about highly sensitive people and how their brains work wonderfully and swimmingly and effectively, then it's confusing to you as a parent when you consider ADHD or ODD, oppositional defiant disorder, or generalized anxiety disorder, or bipolar disorder, and notice that your child's functioning well, impacted by their meltdowns, obviously. It's not in line with some of the other markers of a mental health disorder or diagnosis. And again, there's lots of language and more person-centered language that we're not going to discuss today related to ADHD, speaking primarily in terms of how the mental health industry works officially in its diagnostics right now, which is identifying ADHD as a disorder. So in terms of how that impacts you as a parent, it's super crucial to understand the difference of how your child's brain works for being a highly sensitive child, and the fact that that's a personality, not a disorder. Your child's not broken. So another thing to notice is that highly sensitive people have an inconsistent sensory overwhelm experience. And so what that means is that you might have also found another soup letter set up called sensory processing disorder, SPD. Now, SPD is in layman's terms, an assumption that the brain gets confused with sensory information. And what's important to notice the difference between highly sensitive people and kids with SPD is that your brain is consistently confused by that sensory information, whereas highly sensitive people are prone to overwhelm. And that overwhelm makes them more vulnerable to added overwhelm by sensitive and sensory issues, to include sensations of the body. So for example, if your child most of the time when calm can tolerate tags on the back of their shirt, but when they're anxious, worried, concerned, if they've been stressed, then they flip out as if they're having a complete their brain is offline moment. That can be really confusing and at times quite discouraging for you as a parent when all you're reading about those sensitivities is an understanding of sensory processing disorder. So sensory processing sensitivity, it is different and separate, and it's important to understand that. I have a whole video on understanding the 4 components of highly sensitive people and their personality and breaking those down. And if you need that link, you can go ahead and ask us wherever you're finding this message, and we'll shoot it over to you, because I won't be breaking that down in this video, but we have got plenty of resources for you to understand the trait more thoroughly. So today, related to Psych Evals, I really want to cover this, because if you're treating it like a magic wand, you're going to be stuck. A lot of parents will go down the road of, okay, now if I finally figure out how my kid's brain is working, then I can definitely know exactly what to do. I can know exactly what to do to eliminate the meltdowns. And it's crucial for you as a parent to understand that there are quite many gaps in Psych Evals for highly sensitive people. And I'm speaking about this from professional experience of working with over 150 different families in across the country in our coaching business. And then in our private practice, group private practice, we serve about 150 to 200 highly sensitive children and adolescents every year. So when we notice that and we acknowledge the fact that I've been doing this for over a decade, I've been around the block when it comes to reading Psych Evals. Now, I'm not a psychologist, as I mentioned earlier, but I have read plenty because a therapist's job is to interpret the Psych Eval and then actually put the treatment plan in place if a Psych Eval is, and that's a part of the information that you would gather from the client when you're creating the treatment plan. It can give you information about how your child's brain is, about how your client's brain is working, but it's not going to create the plan of action. And that's super, super important because a lot of parents don't know what actually is included in a Psych Eval, and they end up quite disappointed when when they come to us and they report. We speak to way more than hundreds of families every year across the country and internationally, and many of them will report that they have completed Psych Evals. And I want to speak about what that's like and what feedback parents are giving us when they come to us when they're struggling. And so this could be relevant for you. You might have already experienced this, where you've had a psychological evaluation, you've invested in that service for your child, and it's left you feeling like there's still a lot missing. And it's really important to understand where the gaps are, why you're stuck in that moment, and then what else we can do to support you in addressing that. So let's cover it, okay? So psychological evaluations, they help you understand whether or not there's an intellectual or an emotional barrier to learning and functioning, okay? So what that means is that it doesn't teach you how your child regulates their emotions. It teaches you to assess whether or not there's a barrier to regulating their emotions. Now, if your kid is highly sensitive, you already know there's a barrier to regulating their emotions, especially if you've been listening here. So it can feel quite redundant or even frustrating if you've gone down that path. Or if you're considering it, it's important to understand and to ask and to make sure that if you are seeking a Psych Eval, and we'll talk about a couple of reasons why I do advise some clients to get them, why you might need it and what the purpose of that is. It's just one piece of the puzzle. It's not the whole picture, and it doesn't solve the problem of the meltdown cycle from the root. Okay, so that's important. So they're academic and behavior focused. Okay, but because of that, if your child's struggling in academics and if your child is struggling with their behavior, how they present themselves to the psychologist can skew the results. So I want to notice this, that you want to work with a psychologist if you're accessing that level of support, who is clear on how to change behavior and how to impact a child's capacity to show up for the evaluation effectively. I've heard so many parents say that the psychologist has reported invalid test results because the child struggled with showing up to the testing and being able to be emotionally available to complete those assessments. They're not all the time fun, and they're definitely not interesting for a child who has different priorities than sitting and writing or reciting or doing math problems or intellectual problems and getting assessed in that way. And so it's important to understand how your child can be supported in making sure that the assessments are valid. And that's important because a fair amount of psychologists are trained in behavior modification. That is, as I've mentioned before, quite an archaic way to support children. It's a behaviorist model. Sticker charts, rewards, bribery, etc. doesn't teach internal motivation. And it can also backfire for sensitive kids because they can believe that they won't be able to achieve the goal, so why even try? Or just not be motivated by a sticker in that moment because their emotions are so out of control, they can't see the forest for the trees. And that can be quite frustrating if that's the skill set of the professional that you're seeking support from. And so it's important to understand the background of a psychologist if you need that support and you need that assessment. Many parents will consider needing that assessment and the documentation of a cognitive, intellectual, or emotional processing need in order to get support in the school system, in the public school system, and sometimes even the private school system, depending on your state, depending on how the quality of schooling or the approach of education with the professionals. So it's this video and this training is not meant to say that psych evals don't hold their place in the world. However, it is super crucial to understand that they are not a catch-all and they don't eliminate the meltdown cycle. So let's cover why. What are the 2 reasons why you might need it, right? Now, psychologists, before we get into that, psychologists are not trained in occupational therapy. Occupational therapy is, in a nutshell, a different modality of emotion regulation that supports children in processing the sensory information they receive from the world and helping their brain organize it in an effective way. And so kids on the autism spectrum with an autism diagnosis, or kids with ADHD, or kids with sensory processing disorder, and could benefit from occupational therapy because their brain is overloaded, overwhelmed, and struggling with that sensory input, and their brain doesn't know what to do with that information. However, a psychologist is not trained in that modality. Mental health professionals are not trained in occupational therapy. It's a completely different school of therapy, and you need a different master's degree. So it's crucial to understand that if the main trigger that you observe that your child is struggling with from a sensory standpoint, and that's leading to a fair amount of your child's meltdowns, a psych eval isn't going to give you a clear picture as to why your child's overwhelmed by sensory information, and how your child is struggling, and even design a treatment plan at all, because psychologists are not trained in that modality. This is why we work closely with occupational therapists, both in my private practice as well as in the coaching company here, because it's a different level of expertise and complements the needs of a highly sensitive child, importantly. But again, there's a silo to that profession, just like in the mental health traditional mental health profession as well. So a multidisciplinary approach is super critical. And so when we think about needing to add all of these services for your highly sensitive child, it's important to understand how you're organizing all of this, because that's a lot of appointments for your sensitive kiddo to go to as well. If you're taking them to one-on-one support, and we already know, we've spoken about that here, where the gaps are to just focusing on one-on-one support with a professional trying to help your child adjust to the world differently. Because the relationship that you have with your child, research has demonstrated for decades that highly sensitive kids change their behavior most effectively through their parenting relationship. So let's talk about this. Okay, so sensory processing sensitivity, again, is a personality trait. And so what that means is that psychologists are trained to understand mental health disorders and cognitive processing problems or issues. And so what that means is that your highly sensitive child is being tested for how they take information in from the world, and it's being placed in the framework or the understanding of a disorder, or a deficit, or a gap. Now, the language that a psychologist will use will be related to the Mental Health Diagnostic and Statistics Manual, the DSM, and they won't be likely trained in the highly sensitive personality trait, because personality and temperament is a different subset of understanding how the human brain works and how humans relate to each other. And the assessments that a psychologist will apply with your child are not typically inclusive. They don't typically include temperament assessments because a temperament assessment isn't going to, and a conclusion around temperament is not going to support your child in seeking, and we'll talk about this in a minute, special education services, extra support at school, etc. So if you're seeking an academic psychological evaluation to support your child in school, they are much less likely. I've actually only seen it maybe once. Once or twice, to where a psychologist has understood the framework of highly sensitive people, and they might have some awareness of sensory processing disorder, but typically that's based on the psychologist's clinical experience because they've worked alongside an occupational therapist in their profession. And so a psychologist who works in a private practice with a bunch of other psychologists just doing testing, unless they've had a different position, a different job before they got into private practice, they are less likely to have had a lot of exposure to work hand in hand alongside an occupational therapist. So, myself and my team, we've worked alongside OTs in the residential treatment center that we worked with. I worked at in the community mental health settings. We've worked, and then also, hand in hand, referring through our private practice with a lot of communication. And so over the last decade, lots of experience working with OTs, but that's not typical in the mental health world for OTs and mental health providers to be in communication. And then also psychologists who are providing assessment work are typically different than psychologists who are providing clinical therapy. And so it's important for you to understand that a psychologist who's completing the assessment might not have a lot of knowledge about sensory processing disorder. And lastly, sensory processing disorder is not recognized by the Diagnostic and Statistics Manual, the DSM. And so what that means is that even if your child psychologist did have a background in understanding SPD, they wouldn't be able to diagnose it because it's not a diagnosis, and an occupational therapist is more appropriately equipped to provide that label. So a psychologist would typically shy away from putting that on the report because they don't typically have the clinical experience nor the justification to put a non-diagnosis on an official paperwork. So that is a little bit more long-winded than I wanted to go into related to SPD, but I think it's important to understand what you're looking for if your child is overwhelmed from a sensory standpoint, what paperwork will be necessary and what paperwork would be necessary to support your child academically. So 2 reasons you need an actual psych eval, right? You need to consider a psychological evaluation and get the paperwork for that. And the 2 reasons is if your child is struggling with absorbing the lessons in school, if your child is not able to understand what they are being taught in a public school setting, and this is more typical for kids in public school, maybe even in private school, but private schools can be more flexible, differently accommodating. It just depends on the school and the school's pedagogy, how they approach teaching children, and so to keep it pretty simple for you here today, because I've been talking for a while. I want to just clarify that if your child is in need of extra help and extra support in the school setting, and the school isn't able or willing or available to accommodate that for your child, then a psychological evaluation might be warranted in order to set up a individualized education plan, which would then, that requires a diagnosis for your child and in order for the school to accept it and then change how your child is being taught, which is different than a 504 plan, which changes the environment within how your child is taught and changes the environment for the whole class. So it's a different level of service. It's easier to get a 504 plan, but there are more restrictions on what a 504 plan can do because it's not as individualized, hence the name IEP. So if you think your kid needs an IEP, then you would consider a psychological evaluation, and you would consider that with the school, because public school is required to complete one if your child is found eligible. That's a whole process. And then if your child is not found eligible and you do believe your child needs support in the school setting and needs to understand how to, you need, and the school needs more information about how your child's brain works in order to help them acquire what they're being taught and learn what they're being taught, then you would go down the route of a private psychological evaluation, seeking a private provider for that psych eval. Now, it's important to understand that highly sensitive kids are impacted by the classroom if shame-based teaching is used. You know, if a teacher is using teaching strategies that are along the lines of traditional parenting strategies, my way or the highway, speak when spoken to, suck it up, all of those types of principles, then your child can very well likely not be available to absorb what they're learning. And so it's really critical to understand how your child's being taught before you go straight to trying to assume that your child's brain isn't functioning properly or effectively or typically, if you will, and that's why they're not learning. And so the next piece about this is that this is related to the concept of differential susceptibility. So this is a psychological concept. Differential susceptibility is the term that indicates that highly sensitive people have a much higher likelihood of being affected by their environment, especially their parenting environment, than non-highly sensitive people. So what that means is that highly sensitive kids can end up on one end of the bell curve or the other end of the bell curve, depending on functioning, depending on how they're raised and their family environment specifically, in addition to other environments. So if you're using parenting strategies that are more traditional, that focus on teaching your child to follow your direction and that you mean business and that you're the boss and they're the kid, then your impact on their ability to view themselves as capable learners is very high, to the point where they will be negatively impacted. And that means that they will be much less functioning in the world. They will struggle to function in the world in other avenues, whether that be at your house or at school or both. And if your child's having daily meltdowns, that it's critical that you understand that, because Pluis's research, as well as Boyce's research and Elaine Aron's research and Marsha Linehan's research, I mean, I could go on and on naming all of the researchers in this field, all speak definitively for, as I mentioned before, over 100 years, that highly sensitive people significantly benefit from secure attachment, from a secure, loving, connective, and structured environment. And so what that means is that having a loving, connective relationship with your child doesn't mean that you give in, doesn't mean that you let them run the show, if you will. But there needs to be an understanding of how to set clear and proper limits in a structured way, in a systematic way, so that your child doesn't think that they're a bad kid, or that they can never get it right, or that they are going to continuously struggle, and then therefore why should they even try? We see that more with adolescents. That's the shutdown cycle, we call it, differently than the meltdown cycle, because most adolescents are moving out of meltdowns and into slamming doors, closing their room, just isolating. And so when we speak about the difference and where your relationship with your child matters so much, it is due to differential susceptibility. And so the odds, the research demonstrates consistently that the odds your child has in being on the 90th percentile of those who excel and the 90th percentile of those who struggle is critically impacted by your parenting relationship. And traditional parenting and traditional and mainstream psychology will not highlight that for you. It will not highlight that for you. And a psychological evaluation, I can't tell you how many times I've read it, but it's quite frequent, where we've read, I would say the vast majority of the psych evals that I've read over the years all point to behavior management. Because remember when I spoke earlier, a psychologist, the psychology field is still quite rooted in behaviorism, which is, sticker charts, reward charts, 1, 2, 3 magic. So we see all kinds of parenting strategies being taught in a psych eval, which is the last 2 pages, maybe 3 pages, if you're lucky, of the psych eval is bulleted advice. So there's the interpretation of your child's results, and then there's the discussion points or the general applications of what the psychologist has learned and what the psychologist advises. And so those bullet points might be, suggestion of a behavior modification plan at home, which would be, again, as I mentioned, treating your child like a dog by giving them stickers and good treats and telling them they're a good little boy. And then also might recommend mental health therapy, likely more towards along the lines of cognitive behavior therapy, which has quite significant gaps for sensitive people. And then in addition to that, maybe a recommendation of play therapy, which also has child-centered play therapy has some quite significant gaps for sensitive kids as well, because they really struggle with generalizing the skills that they present in therapy and that they learn in therapy in the home, right? That's one of the reasons why you guys listen here. And so the important piece about this is that if you're considering the need for a psychological evaluation, it's really going to boil down to whether or not you think your child needs direct and specific altercation of their educational plan in order to be served well in the classroom, and taught effectively in the classroom. Sometimes teachers have their hands tied based on the bureaucracy of the school setting. Other times teachers need that accountability and clear and specific goals that you would be contributing to with an IEP. Schools can run the gamut in terms of what your child might need in that setting. However, if you're dealing with the meltdown cycle in either setting, your relationship with your child is critical. So related to this, the next piece is that the second reason that you might want to consider a psychological evaluation is if you suspect your child needs a change, an accommodation to stay on task or to learn. So I have spoken about being available for learning in another live video here, and so definitely go ahead and search for that one. And then also related to speaking about this today, there's a difference between your child's education plan being accommodated so that they can learn, and then your child's education plan being accommodated so that they can be available for learning. And so what I mean by that is if they're experiencing sensory overwhelm versus it being a concern of their intellect and how they are understanding the material. So those are 2 different reasons why you might need a psychological evaluation to justify changing the education plan for your child in the public school system and sometimes in the private school system. So again, as I mentioned before, critical that you work with your child to change your relationship with them, that you shift out of using any traditional parenting strategies, especially if that's not your intuition But that's where you swing when you're frustrated, stuck, aggravated, right? We see this often for parents of sensitive kids. And so a clear system of understanding where your child's sensitivities are, getting clear on adjusting how you relate to them, and then learning how to make feelings playful consistently and systematically so that your child can then appreciate and receive the limits that you set upon them so that they can choose different behaviors to get their needs met. All of that requires breaking down shame and shifting the way that you relate to your child. So that's why we support parents directly for kids who are under high school age. And then by the time you get to high school age, the teen needs to be involved. So if your teen's having daily shutdowns, then we have a different link and a separate training for you to review as well. All right, so go ahead and head over, if you need support with this, to meganthompsoncoaching.com/talk. And we'll book a call with my team. If you are a parent of a highly sensitive child, middle school or under, we work with parents of kiddos in this company, 3 and up typically. And for those in who are parenting teenagers, high school and up, then we would work with both of you, and we would consider whether or not that makes sense, if we're a good fit and how that works. We'll talk to you about that. However, if we're discussing where you're struggling and what you need to do in order to reach your goals, and we find that we are not the right fit, then we will simply share with you what the next appropriate step would be. And so we would cover that in either conversation. And so what we want you to do in order to prepare most effectively for the call is to book a call with us and follow the plan on that process. So go ahead to meganthompsoncoaching.com/talk or meganthompsoncoaching.com/teen talk if you're the parent of a teen high school aged or older. All right. Thank you very much. Have a wonderful day, and we'll speak to you soon. Bye.